Hi, everyone, and welcome. My name is Dave Schmittlein, and I'm Dean of MIT's Sloan School of Management. I'm so glad to see so many of you coming together around the theme of accelerating innovation in the health industry. This is an exciting time for that industry. It's an important time for MIT to do what I think and hope you would expect of a great and innovative institute with respect to making a positive difference. Everyone's busy. It means a lot to me that you came together around this theme. And I look forward to what I know is going to be an exciting and informative afternoon. And it's one that's going to ask you as well for your thoughts and insights. I want to acknowledge that so many school leaders have come to share their ideas with you, to engage with you this afternoon. I'm very proud of the faculty who are doing important work in this area, and again, many of them are here this afternoon. I'll just call out their names because some of you may know some of them, but Retzef Levy, Janet Wilkinson, Kate Kellogg, Tom Doyle, Dimitris Bertsimas, I know is here. I saw him, and I believe that Tom Koken will be here later this afternoon. We actually have about 30 faculty at the school who are engaged with issues around healthcare from their own diverse perspectives. This is a hugely important area of research and of impact for the school, and I hope that today, among other things, gives you a sense of that engagement. I also want to thank the speakers, in addition to the faculty speakers, many of them both prominent in this sector and some of them alumni of MIT itself. We're so honored that they would take the time to be here this afternoon as well. One of our school leaders as well, Senior Associate Dean Chris Schaefer is here today. I don't know if she's here in the room right there. She is right here. Chris has been leading such a reinvention of our alumni engagement for MIT's Sloan School of Management, and this conference is a reflection of her commitment and of her building a team of people who are able to do events like this one this afternoon. I also want to call out the reinvention of the MIT Sloan Club of New York, which has been so important for us, and I know that some of you have been engaging with that club, and I encourage you to continue to engage and, again, use your voice with respect to the future direction of that club. This conference comes in association with a new initiative at MIT, an initiative for health systems innovation. A group of faculty have been gathering, I would say for about 2 years now, but with more formal engagement just over the last year, to focus our activity as a school on some of the key issues and areas of potential impact that the world needs from us in the area of healthcare and health systems. This is an important time for health systems in the world. Changes in demographics, changes in economic development, we know are going to provide new and even new kinds of stresses on the global health system. We need to have something important to say and create important positive outcomes in that regard. Health systems are also hugely important to the U.S., as you all know, with health representing about 17% of the U.S. GDP at this point, and very likely to go north of that, impossible as it seems. How we think in this country about access to care, of course, but also quality of care, the cost of care, how very much MIT-oriented themes like innovation and technology, perhaps in some cases, drive up the cost and perhaps the quality, yes, of healthcare, but could perhaps in the future also do more to control costs and thereby to add to quality and access. This is an important setting for MIT to make a difference. When you think about MIT, I hope that you imagine inventing the future in some of the most important aspects of that future. I hope you also think of understanding deeply complex systems that involve technology and science, but also people, humans interacting with each other, systems that at various points need to be invented or reinvented. That's very much the history of MIT, and I'm very proud of the historical role that MIT Sloan School has played in that kind of impact. That is very much the legacy that our school students and faculty wish to create in the context of health systems. We are engaged in a set of applied research projects that are designed to create that kind of impact. We're also committed to engaging with a set of students who wish to become the principled, innovative leaders that health systems need around the country and around the world. And you'll hear more about both of those elements this afternoon. We're about disruptive innovation. I don't think many of you in the room would disagree that health systems need, yes, the right kind, but need disruptive innovation. And we're about nothing less than that. Now, I'd like to conclude before asking the three faculty co-directors to come up and give you a sense of this afternoon's content. I'd like to conclude with a few things I'm going to ask of you this afternoon. Often I would offer those remarks at the end of the day, but I need to go back to Boston for a meeting later this afternoon. So right now, I'm going to ask you to do something. First, use your voice. Tell us what we're doing, not right now, later today. Tell us what we're doing right, what we're not doing right, where the opportunities are that maybe we're not focused on right now. Talk to us about what we could do differently. Many times our alumni and friends say, I wish I could make a difference at MIT, but I don't know that my voice could be heard. We're shaping and reshaping this initiative now. Use your voice now. Tell us what you think. A second thing I'm going to ask of you, there's only 5, we're almost over. A second thing I'm going to ask of you is to talk about something interesting that you heard, that you learned, that you thought of this afternoon. Talk about something interesting about this to a friend of yours, a colleague of yours, who's not associated with MIT, who wasn't here today. Use your voice to tell others what's going on, and perhaps bring them into this fold as well. Please keep engaging and attending, the third item. Engage, participate in our events. We are an amazing community, we're a lively community. We've come to a place where we can do events like this. We couldn't do events like this 10 years ago. We can, we will continue to, but it's not a party if you don't come. So please, keep engaging with us. Fourth, I would ask you to support MIT Sloan people just in a human fashion. If you can help our students with projects, if you can help make our graduates visible with your organization, if that might be a natural path for them, I ask you to be thoughtful about the ways that you can support the people in our community. And fifth, you know I'm going to ask you for philanthropic support. It's my job, but it's also my passion. I would ask you in this regard to think about the fact that you chose to spend some time here today because you care about healthcare, but also because you have a sense that MIT can and should and probably will do something important. Protecting and sustaining the things that you care about is one of the greatest joys in the world. Please give yourself the joy of helping to protect and sustain activities like this one at MIT Sloan School of Management.